We make no secret of the fact that we are determined to head right to the top of medicine. That's what we're doing. This is a beautiful example of it.
Beautiful example.
I saw a machine
Hablando de la hermosura
in a lab building in Germany at Siemens, which was now a reality.
Este es, sin más ni menos, el que vieron en antes. Es la disposición con todo el sistema instrumental.
We had this vision of what we thought the future of the operating room should be, what the future of surgery should be, and having an administration that was supportive of this future vision. We were able to, with a lot of people's help, create these rooms, which are not only operating rooms that have the state-of-the-art technology, but operating rooms of the future, where we're going to actually...
Que es lo que vieron en antes, pero ya en inglés.
The first hospital in the country to have 2 of these units in the operating room.
Just the whole concept of what is surgery or what is needed to treat diseases is changing. We're going to redefine what a surgical specialist is even, because a surgical specialist now has to be an information technology expert. They have to be a radiologist, endoscopist. They have to be able to do minimally invasive surgery. They got to be able to do conventional surgery.
This revolution is really this merging of intervention with imaging equipment that allows us to be better surgeons and allows us to be minimally invasive surgeons.
In this room, at least 12 different image devices so that you can have multiple inputs.
It starts with the electronic medical record. Everyone has access to it. The surgeon has access to it. The anesthesiologist has access to it. The nursing team has access to it. We can communicate with the pathologist upstairs. We have the images from the endoscope, from the microscope. Everything can be viewed at by the clinicians and the people that are taking care of the patient, so we can get everyone's feedback instantaneously.
We are optimizing the patient's care by putting in the hands of the surgeons every conceivable piece of information in the room, helping the physician do the best job for the patient.
And it's not just the surgeon, it's the nursing team, it's the anesthesiologist, it's the whole team.
You notice the attention to detail where the nursing station over there is. That desk faces the patient. In all our existing operating rooms, and in most operating rooms around the country, the nurses' desks and the computers are facing the wall. That certainly adds to the patient safety.
You can always accomplish much more when you bring many minds from different disciplines together. I think that's really the exciting thing about being an institution like university. I mean, we couldn't have done this without the help of donors like the Helmsley Foundation to mobilize the kinds of resources to build this kind of environment. Basically what this machine can do is if you take fluoroscopy and spin it around the patient, you get a 3-dimensional image. You can see blood vessels in 3 dimensions. You can see solid tumors in 3 dimensions. You can see bone if you're putting in instrumentation and hardware.
By that spinning motion, you can also create cross-sectional images. What you can start to do now is you can start to say, I'm going to operate on the intestine. This machine will give you simultaneously the intraluminal or inside channel picture, and I'm going to be able to see outside at the same time. And this has the capability that we can overlay those images. So you can start to do what I was saying, Jerry. Think about intestinal surgery where the patient doesn't even have to go to sleep.
The average patient nowadays is older, more frail, has more serious accompanying diseases, and so the possibility to eradicate their problem, minimize hospital stay, minimize pain, that's what it's all about, right?
We really want to push the envelope a little bit, and when we start doing that, we don't know where we're going to be able to go with this, and I think that's really the excitement. The excitement is redefining what we're going to be able to do from what the standard of what surgery is now, so that with this we can redefine ourselves and really change the way things are done.
And to me what it represents, not the state of the art, we're ahead of the state of the art.